Living healthy, cardiovascular disease is the leading cause of death in women. The risk is 16 times greater than breast cancer. Around 445,000 women each year have a first time or a recurrent heart attack. Some reports show in the last decade, overall awareness fell more than 20% in all racial and ethnic groups. Despite the danger, only about half of women realize it. Well, joining me now is Dr. Demi, a cardiologist and a she is a cardiologist and a women's heart health specialist at Mayo Clinic. So first off, good morning and thank you so much for joining us.
Good morning, and thank you for having me.
Absolutely. Well, we know statistics show that all women can be impacted by this, but is there more of a common age group that this affects?
So, yes, you're right. In general, heart disease is the leading cause of death among women, and it's estimated that approximately 1 in 3 women will die from heart disease. The risk of heart disease, however, increases as women get older. So, we tend to see this more commonly in older women. One thing I also want to point out is that heart disease also affects women of childbearing age, and we may not realize that as much as we should. It affects almost 1 in 3 women, and it's the leading cause of death, specifically during pregnancy and in the postpartum period.
Wow. So how can women prevent heart disease?
Great question. And the good thing is that the American Heart Association has put together something to make this simple for women to be able to learn about and prevent heart disease. It's called the Life Simple 7. And basically, this is made up of 4 behavioral factors that you can change yourself. And 3 of them are clinical factors that very often you have to discuss with your physician. And I'll just go through it real quick. The 4 behavioral factors has to do with not smoking, maintaining a healthy weight, eating a healthy diet, and also getting regular physical activity or exercise. The clinical factors that are really important in preventing heart disease is making sure that your blood pressure is well controlled, having your blood cholesterol well controlled, as well as your blood glucose levels. These three things that I mentioned, usually you have to have a blood test for the cholesterol and the glucose because it's hard for you to figure this out on your own. But for the blood pressure, we now have, machines that are available over the counter, stuff you can buy from the grocery store or the pharmacies, and you can check your own blood pressure at home so that you're able to take charge of your own health.
Okay. And I know you mentioned diet as one of the important factors to preventing heart disease. So I know often I would hear people saying, cut back on red meat and certain processed meats. Does that at all play a part at all? Can you, break down kind of what that diet looks like?
That is absolutely correct. So, a healthy diet is important for maintaining cardiovascular health. And some of the things you've already pointed out, limiting the amount of red meat is important. Also, limiting the amount of saturated fats in your diet is important. To make this easier for most people, because sometimes when you come up with a list of food items that are preferred to eat, sometimes it's hard for people to keep track. So, for my patients, I usually recommend if there's a diet plan that you're looking for, the Mediterranean diet is one that has been shown in studies to have positive effects on your cardiovascular health. The second one is the DASH diet. The DASH diet mostly consists of, increasing the amount of fruits and vegetables in your diet and limiting the amount of salt that you eat in your diet.
And I know over and over again, doctors say early detection is so important to saving your life. What are some symptoms women should look out for, to suspect that, they may have heart disease?
Great question as well. So I agree with you. Early detection is important. And one of the most common things we talk about is, heart attack. And a heart attack is not the only form of heart disease, but is one that sometimes presents with, should I say, dramatic symptoms. So one thing to look out for is any chest pain or discomfort. I know sometimes women may get confused and say, because, it's been said that women sometimes may present with other symptoms that are not chest pain. So when they get chest pain, they might get confused and not think that this is important. I want to point out that chest pain or discomfort is still the most common symptom of a heart attack. So if you have that, that's an early warning sign. You don't want to sit on that. Other symptoms that women may experience when they're having a heart attack include shortness of breath. Sometimes they have pain in the jaw, pain in the arm, pain in the shoulder, or fatigue. And sometimes it might just be that generalized feeling of being unwell. If you feel that something is wrong, do not sit on it. Call your physician or call 911 if this is severe and not improving.
Absolutely. That is so important to check in with your doctor when you just feel a little bit off. Thank you so much, Dr. Demi. This information was so helpful.
Thank you so much for having me.